Morena, good morning. Can you all hear me? Yes. Excellent. A massive welcome to you all to Whole NZ, our event and our initiative which is focusing around reversing type 2 diabetes. My name is Caryn Zinn. I'm an associate professor here at AUT. I'm a registered dietitian and I'm also the lead for our Reversing Type 2 Diabetes research project which we've got going on at the moment, and I'll tell you a little bit about that later. I want to start by thanking each and every one of you.
It's just a bit of feedback. I don't know if you can hear that.
Just hold it.
That's better. That's better.
Is that better?
Yeah.
Great, thank you. Gives me another opportunity to thank each and every one of you for taking the time out of your precious weekend in February to help us on our mission, which is improving the healthcare for your whānau, your friends and your communities. Today is a full agenda. It's a busy day, and it's a day of learning, it's a day of networking, and it's also a day of action. I just have a few housekeeping rules just before we get into things. Firstly, the bathrooms are just outside this room to your right, and also downstairs right next to
Recording in progress.
the registration. Secondly, morning tea, lunch and afternoon tea are all provided in the finish line where you had registration. More about that a little bit later.
It's pasta and risotto.
It's not any questions please about what's going on today or anything, please ask the folk with the blue lanyards, apart from Grant, because he probably won't know anything about what's going on. But everyone else will know lots about what's happening with blue lanyards. Cell phones, please keep your cell phones on silent or off, up to you. And finally, as you've picked out, this room has great acoustics. And our online people, welcome Morena to our online people. We've got about 20 people joining us online today. They can hear all the little murmurings that happen on the floor. So I ask you please to keep the little murmurings to a minimum or not at all during our presentations today. There'll be plenty of time to network in the breaks. That'll be very good for the people online for clarity. So you are all here today because you've signalled to us that you want to help us in this endeavour of changing healthcare for the better for Aotearoa New Zealand. We will showcase what that might look like in the form of presentations and in the form of panel discussions. Our goal for today is to form a collective with you and also with others moving forward. We have a purpose and a goal to develop a call to action in a workshop this afternoon where some of the collaboration, the networking and the contributions will start. So your role today is to be inspired and to inspire. It's to talk to as many different people as possible, and it is to contribute to our call to action workshop later on this afternoon. This movement about whole food, reducing carbohydrate in the context of a supportive behaviour change strategy for reversing type 2 diabetes and pre-diabetes in New Zealand is a massive movement that is about to take off. So I urge you not to sit back and relax, but rather get excited, get amongst it, and enjoy the journey of reversing type 2 diabetes and help moving this work forward with us in New Zealand. I guarantee you it's bound to be a turbulent journey, but the destination that we're going to, and once we get there, will be well worth it. So again, welcome to everyone. We have local and international guests here this morning, and hopefully this will be a very purposeful and meaningful day for us all. I'd like to hand over to my two friends and colleagues, Professor Grant Schofield and Dr. Glenn Davies, who will kick this off with some exciting stuff. Let the inspiration begin. Funded grant that we obtained last year after applying for 6 years and getting the thumbs down. So that was really positive that the government's actually putting money behind this. And our team of academics, if we can just make yourself known. So it's myself and Grant, Catherine Crofts, who is also a pharmacist as well as an academic, and we've got we've got other academics on the team, but they're just not here today. Our clinician team, you've met Lily, she did our karakia this morning. You've met Glenn, he was the good and the bad doctor. We've got Dr. Marcus Hawkins, we have Dr. Olivia Curry, and am I missing anyone? And and Lily next to her. And that's our team of clinicians. We've also got a Māori and Pacific Island governance board that are advising us and walking with us along the way from a cultural perspective. Okay, thanks everyone. Hello to the online people. We can see you, we can see names, and we can see some faces, and I recognize some faces, so hello and welcome. We would like to start in this feedback session. We would like to start with the onliners. Now, we haven't got you in a specific cohesive group, like-minded group necessarily, like a health professional. We've just sort of lumped you all together, but that hopefully will work. So we'd like to invite you guys to tell the group what your top 3 action points are to help progress this work in New Zealand. Who is our spokesperson? Cynthia, you look like you are dying to be a...
I can be a spokesperson for our group of 2. We did have Bala with us, but he cut off. So there was just 2 in our group. There was Janet and I. We had a discussion about what we could do, and we were wondering, obviously we can do small things in our own communities because we're both single practitioners working by ourselves, and that although I do have metabolic reset that I do in addition to my health coaching business. But anyway, we thought that if you were nationally, you were doing something, then we would be happy to, join in with whatever it is that that what is people come up with, that we would be happy to do something, at the same time or in conjunction with.
Cool. That's great.
That's the spokespeople for the other groups that we'd like to.
Are you both health coaches?
Yes.
Yeah, okay, great.
So I'm a registered nurse health coach, and Janet's a pharmacist health coach.
Okay, that's great. So there were no specific actions that you came up with that you'd like to volunteer, maybe 1 or 2, or is it more just, you support what this group is doing and you would help things as they happen?
So we thought that we could start small, and we could run, like a group session in the community for those that wanted to, and, that we would provide that service and have a small group, and in return for us learning what it was like to run the group sessions, they could reverse their type 2 diabetes or improve it, or reduce their insulin, or whatever whatever their goals were.
Awesome.
And we could be there to assist them. That's what we thought, but I don't know. Be interested to see what the other groups came up with.
Okay, thank you. So some local sessions. I'm just writing all these points up on the board, and so your group of your duo of health coaches, saying that you can do some local sessions. Thanks, Cynthia and Janet. For the second online group, would you be happy to tell us your action points, what you were talking about? Who's our spokesperson? Is anyone there? Shy, yeah. Maybe they've just gone for a cup of tea. Helen, hello. Welcome.
We were just finding the unmute button. Can you hear us okay?
We can. Beautiful, thanks.
Okay. So there were 3 of us in our group. The other lady is a dietitian. And the things that we came up with were first to do pre-cure healthy habits course for all of our kaimahi, at least in our tari, in our office, because there is a few of us, to do the healthy habits course to encourage people to be able to walk the walk rather than just talking the talk. The second one was we have educational days where we get speakers in to come and talk to us, to come and give us education and things. And we do have a dietitian coming to talk to us, but we thought we might try and find somebody who at the moment my only person as an example is Caryn Zinn, a dietitian who is prepared to speak other than alternative best practice information.
So where are you based, Helen?
We are in the Waikato.
Okay, it'll be my mission to find someone to come and help you. I will take that on as one of my action points.
She'll be there.
Oh, no, I can be there. But for the sustainability of it, potentially we can find a dietitian, in Waikato. Thank you, Helen. Anything else that you guys came up with?
And then the third point was the other lady, the dietitian, who is based in Wellington in Lower Hutt. She said that she would like to engage more with the health coaches and provide them with education and things.
Great. Whole food education? Whole food carbohydrate reduction education?
Yeah, sorry.
Awesome.
Yeah.
We have a winner.
Hello, Caryn. Yes, whole food carbohydrate reduction education.
Awesome. Love it.
Sorry.
Love it. We have a win. Thank you. Thanks very much, online team. Anything else that anyone would like to add to that? Okay, great. Thanks very much. I'd like to invite the GP group to who's the spokesperson for the GP group? Lily. Lily, what have you come up with? Top 3.
So I guess our biggest mission was around influencing our peers and influencing the training of our young doctors coming through. So one strategy is having a local website that goes New Zealand specific, has our own resources with the kai that our whānau eat across ethnicities, links to existing education. So obviously we have pre-cure within New Zealand, but also the international training that David Unwin provides that has credits for our CME, continuing education, so that we're making it attractive for people to be able to get their points, and then research database similar to what is on your the coalition website. And then looking at how do we influence/infiltrate national bodies such as Te Whatu Ora, the college, BPAC, Goodfellow, and just Bruce Arrell couldn't be here today, and I haven't actually said that for GPs, but Bruce Arrell is really keen to have a talk with the Unwins, and they've agreed. So watch out in the Goodfellow unit. We will be having the first session coming up soon. I don't know if his pen's still due in yet, but so it's really great that Bruce Arrell is jumping on this waka with us. And
Awesome. Can you just explain to the rest of the group who Bruce Arrell is?
oh yeah, so Bruce Arrell is like the ko-matua of GP everything in New Zealand. So he, in order to, his official role is for Goodfellow, but he is the Goodfellow unit, which is one of our education providers. They do a conference and they give us Goodfellow gems by email. So he doesn't always control the content on those. So he had a pro-low carb one month, and then the next month endocrinologist put a anti-keto one on. So, there's a bit of banter that goes in, but that's okay. That's part of, medicine, is that there's lots of ways to skin a cat, and we're not, we're open to things as long as they've got evidence behind them. That's the second one, and the third one was around the idea of the charity and the advantages of having that in terms of being able to get donations from people to provide things like conferences, research potentially. A bit of round and round about what that could look like and the purpose of that. Those were our top three.
Awesome, thanks. Can I ask a quick question? Is there any way to infiltrate the doctor training at university level?
Yeah.
Right.
Yeah, that could be a really good way of doing things differently, because I think they will have a different mandate, and so you might not want to start with the ivory towers. Go for that one.
Easier to break into a Swiss bank.
That is a good idea as well.
I was talking to Lizzie earlier today about the GPs versus the dietitians, and I know the GPs are saying they haven't had much training, and I think that could be a good thing in a way, because they don't have this historical mantra of the guidelines, and I find that the GPs that I've worked with have been way more receptive to change, because they've gone from knowing nothing to knowing something which is physiologically sound. Whereas the dietitians, the minute you say anything, that you get the hand, apart from the dietitian that's online and myself and the Canadian one who's going to get registered soon, you get the hand in the face, because it's like, oh, but we need all those nutrients from all the 4 food groups and all the whole grains. So I think that negative could potentially be a positive, and if we can get into that training somehow, that would be a win. So we might connect about that Waikato new training. Thank you, GP Group. Really appreciate that. Health coaches.
We come up with some similar things. One of the things that we thought would be a really cool idea was sort of a national model in regards to health coaching. So something that can be, if I was to go down south somewhere, I'm taking the same knowledge, just as our nurses do. They get taught the same way, and they can practice anywhere they register. But health coaches, in a way, it's the same model of learning through nutrition, through the mental health aspect, the behaviour change, all of those, but under one model. And I know that comes from a higher, we know it starts up in a government sort of decision-making place.
Sorry, I think I might be misinterpreting. Are you saying trying to influence the training of the health coaches so that they all get this? Yeah. So in other words, like the pre-cure sort of gold standard training into all the health coach.
Yeah, not a 1 week and you're a health coach.
Yeah.
Something that's comprehensive, because I've worked with someone that's done 1 week health training and they're, I'm a health coach. You're like, oh, cool. So you know, and they're like, no, I never learned that. Okay, so cool. So it's like, well, we've got heaps to do. Another one was having opening our workspaces up so other practitioners can come spend time with us. So those that are practicing and doing it really well, bringing other practices in so we can share our knowledge and they can take it back with them, or we can go down there and do some work with them, but sort of reciprocate it so that we start to sort of try and get the same results that we're striving for. So we thought that was a good idea. One that was brought up, and Lily brought it up in her question when we were sitting there about, that safety aspect. Some doctors won't know, so if you're doing it in a private space, you go back a letter. So it's something that our GPs can have, like, and you're talking about infiltrating, like, our doctors in some way of educating them in that nutritional space or low carb space, to use it as a therapeutic way of reversing or putting diabetes into remission, but doing it at a student level is great. I have actually have a lady come into the cooking class that she's type 1 diabetic. She works in that space, and she's asked me to go and do a talk or a cooking class like I do with the students and show them why we do it and what help it has. So she uses the same approach with her type 1 diabetes. So it's been really cool. She's really open to those kind of things. So the potentials are there. We've just got to keep planting those seeds, and even if they don't grow, plant another one. Keep going. Be persistent. And just better support for our HCs from right through a management level. You know, working from our management GPs, and for our health coaches to be really confident in what they do, they definitely need support from a management level to know that they are getting the right information, the right knowledge, and that they can support whānau the best way forward. Just to let you guys know, Mary Hannah had a lot of input in that one, and she realises that it needs to go back up through the chain of command, so that our HCs are getting the support they need.
So what would that look like? Better support by management?
So we, like we said, that knowledge and training, the correct knowledge and training, the support through the GP. So the GPs are providing, so when a GP goes, would you like to work with a health coach because they've got diabetes, it should be the first choice, not offering them medication. Go, we can actually do it through nutrition and HC support. Would you be okay to do that? And GP support, you know, it's a combination of all of us working together, but we need that to be right through. And then even those that are behind the counter have an understanding of whānau pā. Have you ever thought about getting some health coach support from us? They might be dealing with other things besides diabetes, but it's just right through our admin team. In Tūriki, we're quite lucky. We have that. I'll get an email, a text message, a phone call, and they'll say, oh, Jared, someone's needs some support. Would you go give them a quick call and sort of delve more into that with them? And patients don't get asked that. So we want whānau to feel special and thought about and ask the right questions. So yeah. And that was it really, and you know, correlate the evidence and the data so that we've all got it in one hub, and we just go one central space.
Awesome, thank you. Can I ask a curly question? Did you talk about funding issues at all?
Yeah, funding is, yeah, I mentioned funding. Sometimes you just gotta be really innovative. There's heaps of funding channels out there, and so you just have to be really, really good at and work with the right people that know how to get it and funnel it your way. Yeah, so it is a hard one. Funding is always, and for training and everything, you know. So yeah, that is a really important. Funding is probably should be right up the top to help us be able to get that national training sort of model for us.
Great, thanks. Some great ideas. Thanks, Jared, and thanks, health coaching team. With the funding, I was just, I was always really impressed talking to Lily and saying, how did you get your health coaches? And she goes, well, we've got these funds. I just sat down and said, and she said, we need health coaches. And they were there. So I believe there are funding pots in PHOs, and there is funding to be accessed. And I think it's about pushing the need and showing the evidence, and perhaps that funding will go the right way.
That was another thing, was like Dr. David Owen showed it on Thursday about the savings, the savings of money.
Yeah.
That money can be put back into training, offset into training and funding to support those that want to learn. So if you can present that model, every practice will go, oh, we can save money and we can train and put it back into us to give better support to our whānau.
Cool. Kia ora, thank you, Jared.